Okay, so let me just break the session. So thank you, Rupinder, my old colleague, my old friend, from the legendary days of Alexandra Hospital. To the people who are here today in the live, thank you for joining in. Today, myself and Rupinder will be talking about teletriage lah. So if you don't know what teletriage is, or if you have a rough idea about what teletriage is and you want to know more, I think this is the session to talk about it lah. A brief introduction of what teletriage is essentially like triaging. You do a very fast, quick assessment, quick screen of the patient to determine what kind of treatment or the severity priority that the patient needs. But I think with teletriage, it's a bit different lah. Okay, so maybe Rupin, you introduce yourself lah.
Hi, I'm Rupinder. So I'm a nurse myself. I was working with Yurihan also previously in A&E, and then after that, I decided to join Teletriage to explore myself in nursing, basically. Yeah, Teletriage is basically a conversation that you will have with your clients through the phone, and actually to understand their symptoms, medical symptoms that they are experiencing during the call, and basically, why we had this teletriage in Singapore is because we want to reduce those non-urgent or non-emergency cases in emergency department, basically. So because
Okay.
overcrowding of emergency department that you can see quite recently, so we trying to reduce that. Yeah.
Okay. I understand the initiative for this teletriage is correct. Is to for Singapore context is to
Yes.
reduce the ED attendance lah. I think that is the number one priority. But so far, I'm not in your position. But do you think it has been successful or not?
So far, yes, there is changes, and there is improvement. Our statistic that we had for the last 2 years that we are operating our services.
So these 2 years, it has been quite successful I would say. Apart from like reducing ED attendance, I'm just curious, is there any other agenda that this teletriage hopes to achieve? Not?
Those patients who have medications questions that they does not need to go to any medical health facilities lah. So we can actually provide them with these pharmacies, community pharmacies, or either community nurses to visit their home if they need to lah. We are looking into that for future. We haven't started yet.
So from what you have mentioned, Rupinder, so it seems that teletriage, your team would probably play a vital role in offloading. So you offload the volume and capacity from ED, and then also now you mentioned that you want to offer advisory services as well. So you will be the middleman, then you send them there, that kind of thing.
So basically, we will actually assess the patient and find out what is exactly their main inquiry about lah. Is it medical condition or is it purely about medication? If medication, we will ask them if they have any symptoms at the point of the call. If not, then purely medication, then yes, then we will refer to other facilities, other departments that need to be transferred to.
Okay. Well, good. So I think this is where I will ask my question. Do you work closely with other departments in your facility or external?
Yes, we are working now. We are actually planning with pharmacies. How can we go about with the workflows and everything? How do we transfer the calls? Are they able to answer our patient inquiry? So we are actually working out on all that stuff first.
So with that being said, so now you already mentioned that you will be working closely with pharmacy, but I'm pretty sure my guess is that you are working closely with your institutions, urgent care or emergency department as well right now.
Correct.
Is there if it's possible can you just give us a quick rundown of the flow okay, I call you, hey Rupin, my leg pain
Okay, so basically when the phone rings, between the 3 rings, we usually have to answer the call. So once we answer the call, we will just introduce ourselves. We will actually ask the patient's name and age. So we ask what exactly their inquiry about. Let's say for you, like you say leg pain. So I say, yes, sir, I understand that you're having leg pain. I can help you. But before that, can I get your few details from you first? Do you have any past medical history or are you on any long-term medication? Because the thing is that we can't access the NEHR or either
Oh,
any.
okay.
Yeah,
So
so
go
that's
blind,
the
you
thing.
go.
So every call is a new call for us.
So let's say you have determined that this patient requires this kind of care. Let's say you think GP or specialist care. Then what happens next?
We assess the patient, right? We have these decision support tools that we
Oh,
use to support
okay,
us.
okay.
So because we need black and white in order for us to make a decision, we can't anyhow make any decision or like patient A can go to this place, patient B go this place without any black and white and support system lah. So we have this clinical decision support system with us lah, that we actually assess the patient and ask the question about it. From there, then we will decide where the patient can go to. Yeah.
Oh, okay,
But
okay,
this
okay.
decision support system is not locally, it's actually also from overseas because locally we doesn't have any teletriage. So we are actually adjusting that the decision support tools into a locally content also lah. So we have already come into a decision like like for them it's called 911, for us it's 995, right? So that kind of thing. Then
Okay,
they got PCP, we don't have PCP, you
I
see.
see,
In
I
overseas they
see.
have, yeah. So all these things we need to change and all that stuff. So we use
Uh,
that decision support system to actually do the judgment where the patient actually can go. So for instance, let's say the patient can go to urgent care center. So we will ask the postal code from the patient. So
mm,
we will roughly get an idea where the patient, their location is. So for example, if they are north side, the nearest is Admiralty Urgent Care Center. If let's say you are staying in the west, I
yeah.
will recommend you go to Alexandra Hospital. So we will actually tell them based on your condition, it's not an urgent condition that you need to go to an emergency
Okay,
department.
okay. Alright,
Your
right.
condition can be assessed, over. So we actually will advise them. But at the end of the day, right, it's up to the patient.
Let's answer one question by Mabel. How's the uptake of teletriage services? Busy or not? A lot of calls.
All right. Basically, we have about
12 to 20 calls a day. Okay.
yeah. So it's actually progressing lah from the start that we started in 2021.
Hmm.
It's actually progressing the call.
Okay.
Yeah.
So I'm wondering,
Mm-hmm.
so apart from calls and the person already called you. Do you do follow up calls, not? The
Okay.
patient,
Well, so how do we know whether the patient go to the disposition that we given? So at the end of
disposition.
the we take
Hmm.
we name it as disposition.
Okay. Okay.
So basically what we will do is that we will do a call audit. So there's a team who will do a call audit for us. They will call this patient and ask them about the feedback of the services. How is the services? How is the nurse that spoken to you? How do you rate the call,
Who?
quality call with the
Who? That shut.
nurse? And do you go? Yeah, do you go? To the disposition that given to the nurse from the given by the nurse to you. So let's say they say yes or no or whatever lah. So we will just document down, but mostly they will follow our advice.
Oh, okay, okay. I think that's good to know. Uh, Another question by Mabel. I think this is probably something that is your committee is steering lah.
Yeah.
So I'm not sure if you are involved in this. Will you know that what are the initiatives apart from social media and what are
Uh-huh.
the other initiatives that your organization is doing lah to
Okay, so
encourage?
basically they are actually having like road shows. When they have any road shows, they will actually promote our numbers. And
Oh,
also we do have some hospitals that willing to advertise our services. For example, Ting Fong, they do have
before
our
lah. Hmm.
number in their website.
Oh, okay. So, oh,
Yeah, so some
interesting.
hospitals do promote our numbers. Even some polyclinics also are giving the patient our numbers. Some like so called like senior activity centers, they are giving out our numbers to them lah to
Oh,
call
okay, okay,
us.
okay.
Yeah.
Means it's very good. Means you are getting the support from all the different clusters. Okay. So another question here. So, if we cut down ED visits, where do
Mm-hmm.
the patients go?
So they
ED?
have disposition is actually call 995, ED, urgent care center, or GP. So we have
Oh,
these
okay,
four
okay.
option, and also now we are doing home care advice. So for certain cases or certain medical condition, you do not require to see a doctor. So we actually recommend you to stay home and observe your condition. But we give you all the red flags
Yes,
to
yes.
be monitor. Yeah, so we're doing all
Okay,
that
okay.
now. Okay, so because you need this skill in teletriage you need to build a rapport with with the caller. If you can build the rapport with the caller, right, definitely the caller be very comfortable,
Actually,
and
yes. Yeah.
they will be very easy talking to you. If not,
Actually, yeah. I agree with you, Rupin. Because I think this when you speak to somebody on the phone, right? I think your tone, your tonality, your approach matters a lot, because that person cannot see you, right? That's the only sense that he or she can utilize is hearing, So how you speak, you frustrated, that person can also sense. So I
correct.
think this because it happened to me also lah. Because just sharing because when I was doing like my previous ISS job, right, I was like I sounded a bit tired, Yeah, so then I was on the call like very tired Then the caller can pick up, sia. You sound a bit tired. How many hours have you been working? But it's just a genuine question from the caller So in that aspect, it kind of triggered me. This person can sense that I'm tired. Okay. So I'll be more. The next time a call comes in, I always more mindful Okay, just I think approach matters a lot Next question. So we kind of know what you do as a teletriage nurse, but will you be able to walk us through what happens in a normal day for you?
Okay. So let's say we start our shift in the morning. We'll start up our system. We have actually 5 systems to be operating on.
Yeah.
So one is our phone system, our physical phone. One is via the laptop, the phone
The
system that we are
soft phone
using, the soft phone and the hard phone
Okay.
basically.
Okay.
Yeah, and then we also have a SMS system where we only will send SMS to the patient who are going to only Kampong Admiralty Urgent Care Center. We have our decision support system. So basically, in our decision support system, we cannot key in the patient phone number, name, age, or any personal details, PDPA.
What,
So because then we created, because this is the OC
Oh,
module where they also
okay.
can view the system.
See,
So
see.
to prevent any PDPA leakage or whatever
Mm.
So we created Form SG where we actually will key in all those patient details in it
So that
So our notes
okay.
will be written inside the decision support system. Yeah.
Okay. So only your teletriage team can access the notes, or other people can access the
Only
notes?
our teletriage
Oh,
team.
okay.
So basically,
Wow.
we are actually adopting this. If you all know, in UK they have this NHS 111. So in UK they have this NHS 111, which is the non-emergency hotline that the caller will call in So we're actually adopting their system into Singapore.
Oh, okay. Because so the model that you take, like for your working model, you
Mm-hmm.
take from the various parts NHS, side, is
Correct.
it? Oh, interesting. So after that, takkan dia call, takkan every time
Then we
call
will
ni,
do a
obviously just
test
other things.
call.
Oh,
We will
just
do a
call.
test call. Yeah, because we must make sure our line is operating well. The
Okay.
service, the call can flow in. So we will do a regular test call daily. Yeah.
Okay. Oh, Ira got a question.
Yeah.
Thanks, Lupin. Well, I'm not done with you. Uh, okay, wait. We finish our this one first, then
Yeah.
we go to Ira, okay? So you do test call, blah, blah, then I guess the bulk of your day is addressing all the calls lah.
So
Is
then
it?
we wait for calls to come in basically.
Okay.
Yeah.
Then on top of that, do you have like other ad hoc things that you need to do?
We will
Like,
help
do you,
we help the because we are part of UCC and ED department. So we just help them. You know we haven't opened up our hospital yet.
oh,
If
okay.
you know where I'm working.
Okay.
So actually we are
Okay.
helping in certain things to do for them also We do
Okay.
have some ad hoc work, yeah. Not that we sit down and shake leg
That one I also want. But then when your institution launch, then I guess there will be ad hoc. You need to ad hoc support the departments as necessary, is it? Is
As
that the
for now,
expectation?
no. No. As for now, we are fully a teletriage nurse.
So that goes to my next question because we wanted to know, like at this point in time, right, do you as teletriage nurses, right, do you guys still do bedside care, bedside clinical care?
No, we don't. We don't do any bedside care. We
Oh,
don't do a physical contact with any patient.
it's a bonus, yeah, to some people. Because some people, I don't know if you've been following this page, some people have been asking me a lot of times, like, what roles are there that they can, what roles are available they can do that doesn't consist of bedside care, but at the same time utilizing their clinical knowledge. Because this one, you have to admit, like, if for a teletriage nurse, I think to be successful, I think having enough bedside care experience matters.
Correct, because you need some certain cases you need to use your nursing judgment and
Correct.
clinical knowledge.
Because sometimes the questions, the patient's presentation that comes to you may be very grey. Then it's like you'll be
Correct.
like asking yourself like once, twice, three times, right? Where should this person go, right? I think somebody asked me about this before, and then the same thing I say, like you need at least like 3 years, 2, 3 years of experience lah to be
Correct.
successful in this role. If not, I think you will struggle lah. You'll be doubting yourself on where you send these patients to. Okay.
Yeah, so like say, I mean, for me personally, I feel that I want to be rotated into ED also lah.
Mm.
So that I don't lose touch on my
Yeah, correct, agree.
clinical knowledge, you see. So I did that. I did actually ask my sister on it. So they said they were actually willing to rotate me. Whoever keen to rotate lah, to be rotated, they will help us to maybe make a schedule or something like that.
Because I think it's possible because ultimately it's just a question of manpower. Okay. So no bedside care, but can be rotated. So utilize this session lah. Make the most of this session. Okay, Ira's question. Yeah, consider a referral. So referral under GP first. If the patients are P3, they can jump queue for doctor consultation. Okay.
No,
So first of all, it's not a referral.
no,
Okay. So it's a recommendation.
it's a recommendation.
Oh.
So we only recommend them to go to whichever nearest, either nearest ED or nearest UCC or nearest GP. Now we are looking into like how can we maybe write our triage note, something like that. How can we send to a patient so that the patient does not need to repeat when they go to those institute lah. So we are looking into that yet lah. We haven't finalized it.
Okay.
Mm.
Yeah, because I think ultimately they might because this service the way I see it, right, because patient has been utilizing this for more of a advisory kind of thing. But I'm not sure because I have a feeling that ultimately they might move into really referral kind of thing. But then again, if you want to talk about a referral, then there'll be a question of coordination of services and all that. Then I think it'll be very mafan. Then
No, for referral, it could be for like community nurses. It could be for like diabetic nurses, case manager. That one we can consider as referral. But if they
okay.
want to go to ED, want to go to UCC or GP, it's not considered as referral.
I
That's considered as
see.
recommendation. Yeah,
Okay. So you do referrals and recommendation.
that is in future referral. Haven't
Okay.
yet. We are planning on
Okay.
it. Yeah.
Well, interesting.
I want to let y'all know. Okay, so basically, even though before you can sit independently on the teletriage
Okay.
as
This is
an
good.
independent nurse, what kind of training that you need to go. Yeah,
Good.
so that is important also.
Yes,
It's
correct.
not that anyone can just come in first day, sit down and answer call. No.
Okay,
So
correct.
yeah, so like for us, when we first started, we actually undergo you need to go through the emergency all right, ED triage course, and then you need to go through telephone triage course. But for us, we done it in syllabus. But now me and my team have already created local content telephone triage, and we are awaiting for approval. So if that has been approved, then we will proceed with the locally telephone triage course. And also because we don't have any data, official data in Singapore for telephone triage yet. So we are actually using this teleconsult and e-learning. So we have to go through that also.
Okay.
Yeah.
Okay.
Mm.
So,
And also
sorry, sorry.
yeah, and also we have 18 call scenarios for telephone triage that you need to pass. If not, you can't
Viva,
be. And also we have 20 call logs. When you're on the call, you need to buddy with your senior to make sure your disposition is correct.
okay, okay, understand.
Then after that, you can be independent, answer the call.
Okay, okay. Wow.
But for me, special, we went to SCDF lah. We
Oh, for the
answered
training, is it?
the P3, P4 cases. Yeah.
Oh, so this training, right? So does that mean that you are there any other like restructured or governmental institutions that are doing this training, or is it your place only right
Oh, we
now?
are the
So
pioneer.
as in through the answering of the question and basic explanation, like example talking about Fong sharing the phone number, we indicating the cluster. Oh, okay, okay. Actually worried for you that we're talking about
Mm,
this, eh? Then we
mm,
are divulging where you are working at. But I think this
mm.
is something, Shuchu, this is something that I have talked to Pinder about, and she's actually okay with it lah. If you guys are trying to investigate where she is from lah. So yeah. But anyways, I think regardless lah, I think we shouldn't restrict this divulging of non-sensitive information. I think it's more of a awareness for everyone, for nurses, and I think it's good lah. So I feel this kind of thing shouldn't deter knowledge sharing. And then, but thanks Chuchu for giving Rupinder's identity some thought. Yeah, but I think you all know where she work already lah now, by
Yes.
now. Okay, talking about preceptor, Talking about preceptor. So, my next question, how is the career progression like? I mean, you've been in bedside care, in ED, clinical nursing, bedside nursing. There's the progression there. We know how's the progression there. It's like, right? So,
Okay,
is
so
it the same?
is
Okay, please,
different.
please.
Different.
Okay, please.
Because we are not doing
Share.
bedside nursing lah, okay? So if you are not doing bedside nursing, your progression is definitely slow, to be
Okay,
honest to you. Yeah. And by the way, the career progression for telephone triage, because we don't have any official data yet in Singapore,
Mm.
so we don't know where can we bring this telephone triage, whether can we be like same level as 995, like for non-emergency calls, we are not sure yet. So we actually
Oh, okay,
yeah,
okay. That's a good one again.